Welcome to How to Avoid a Heart Attack. I'm Dr. Marc, a heart surgeon at the Cleveland Clinic, and my goal this half hour is to keep you out of my operating room. At the Cleveland Clinic, we know a few things about heart care. Together, our team performs more than 4,000 open heart surgeries each year. We are honored to be named #1 in heart care for the last 20 years by U.S. News & World Report. Heart disease is your #1 health threat. It's greater than breast cancer in women and greater than prostate cancer in men. But the good news is that we do have some control, which means you have some control. We are constantly learning what causes heart disease, how to prevent it, and how to keep you healthy. Today we're going to talk about changes in guidelines for cholesterol and high blood pressure, the foods to eat to keep your heart in its best condition, the best type of exercise for your heart symptoms that you should never ignore, and what happens if you do have a heart procedure. I'm going to walk you through what that's like before, during, and after surgery. The 3 most important numbers to know about yourself to prevent a heart attack are your blood pressure, which should be 120/80 or less. Your LDL, or bad cholesterol, should be less than 130, and if you've had heart problems, less than 100. And third, your BMI, or body mass index. That tells if you're overweight or not. If you know how much you weigh and your height, go to your computer, search body mass index, and plug in the numbers. You'll get your answer. 19 to 25 means your weight is normal. A BMI of 25 to 29 puts you in the overweight category, and 30 and above, not so good. That means you're in the obese category. Heart disease is not a death sentence. I talked with my colleague, world-renowned cardiologist, Dr. Stephen Nissen, about changes in our approach to cholesterol and new information concerning cholesterol guidelines.
As long as I can remember, we told patients, don't eat too many eggs, don't eat too much cholesterol. And now the guidelines say that cholesterol is not something of concern. The reason it changed is that there's not ever been really good research that suggests that dietary cholesterol, the eggs, for example, drive up blood levels of cholesterol. Most of the cholesterol in the blood is actually made by your own body, by your liver. And so if you change how much cholesterol you eat in the diet, it doesn't really change your blood level very much.
Drugs to lower bad cholesterol are saving lives. What about a drug to raise the good cholesterol?
We've been working and working and working to do it, and we haven't been successful. Many of the drugs that we've tried to use have turned out, when they were studied rigorously, didn't reduce the incidence of the things we care about, like heart attack and stroke and death. We have a class of drugs in development, and actually I'm leading one of the trials that's doing that can more than double levels of good cholesterol. That study will be done in a little more than a year, and we'll have an answer. It may or may not work. If you have a problem with low levels of good cholesterol, lifestyle changes do make a difference, but we don't have the drugs.
If anything hurts, tell me, okay?
And can your feet reveal secrets about your heart health?
There are some things about feet. For example, if you lose your pulses in your feet, that can be a sign that you've got blockages in the legs. And so we always examine patients. We measure their pulses in their hands and in their feet. And if the pulses are poor in their feet, they may have a problem with circulation to their lower extremities, and that could be a sign of trouble. But other than that, it's really not a particularly important window on the heart. There's a big debate going on now, and it's really hard about this issue of saturated versus unsaturated fat. There are some people, including myself, who are questioning whether the saturated fats, the milk fat, and fat that comes from meat and some other sources, are as harmful as we were led to believe. There is a type of fat that the evidence is really strong you shouldn't be eating, and that's something known as trans fats. It often appears as hydrogenated or partially hydrogenated vegetable oil on the label, and people should read labels. A lot of packaged foods are made with these trans fats, these hydrogenated oils, and they are pretty clearly associated with increasing the risk of heart disease.
I am always asked about the best foods for your heart. Well, they fall into 5 main categories, and these are the things that we should see in your grocery cart every single week. Fatty fish, dark leafy greens, nuts, legumes, and whole or ancient grains. Cleveland Clinic dietitian Julia Zampano explains the categories.
Fish is the best source of protein when it comes to foods for your heart, specifically fish that are sources of omega-3 fatty acid. Things like salmon, tuna, herring, mackerel, and then you can also get plant-based sources from things like flax seeds or chia seeds.
Omega-3s have been known to lower triglycerides, help lower blood pressure, and reduce inflammation. Next up, dark leafy greens.
Spinach would be probably the most user-friendly because you can do it raw as well as cooked. Kale the same, both great sources of tons of vitamins, fiber, protein, B vitamins, and then the other dark greens like collard, mustard, any of those would apply.
Also important for eating heart healthy, nuts.
Number 1 taking the chart would be walnuts. Second would be almonds. And then along the line would include peanuts or pistachios, hazelnuts. The ones you want to limit would be the ones that are higher in saturated fat. So those would be cashews, macadamia nuts, Brazil nuts.
Choose unsalted when you can. When it comes to legumes, there are a lot of choices.
Beans and legumes are a great source of fiber and protein for a replacement for a meatless meal. Kidney bean, pinto bean, black-eyed peas, black beans, great northern beans.
Lentils also fall into the legume category. Dried beans and frozen are best, but canned are okay too, as long as you rinse and drain them well to remove as much of the preservatives and salt as you possibly can. Lastly, grains. Whole grains, or so-called ancient grains.
Oats, quinoa. Then you have the buckwheat, barley, rye, millet, amaranth. So some of those are a little more challenging to find at your typical grocery store, but they are included in some foods as well. So you could scan your ingredient list in your 12-grain bread or your 12-grain cracker and look out for some of those heartier grains that provide really good sources of vitamins, minerals, iron, protein, fiber.
Another important reminder, when you're buying ground meat, those percentages do matter.
The higher number, whether it be 80 or 70 or 90, is typically the percentage of lean meat. The lower number, which is anywhere 40, 30, 20, 10, is the percentage of fat.
Coming up on how to avoid a heart attack, the heart symptoms you should never ignore. Also, do you really need to be taking blood pressure medication? The guidelines have changed, along with our views on salt. And what if you do need heart surgery? What to expect in the OR and during your recovery? How to avoid a heart attack, we'll be right back. Key risk factors for heart disease include high blood pressure, high cholesterol, and smoking. About half of all Americans have at least one of these 3. Other things that contribute to heart disease are diabetes, being overweight, having a poor diet, being inactive, and excessive alcohol use. Welcome back. Even if you do everything right, sometimes you may still wind up needing heart surgery. Sometimes it's due to something you were born with. First of all, don't panic. Before heart surgery, I always tell patients they don't have to worry. All they have to do is show up and go to sleep, and I promise that my team and I will stay awake. After you're asleep, we'll do the surgery. That involves an incision on your chest wall. We do use the heart-lung machine most of the time, which means we stop your heart. But don't worry, it always starts again. When you wake up after your surgery in the ICU, ideally the breathing tube is out, and my goal at that point is for you to be able to say, that wasn't so bad. How do we achieve that? We take care of your discomfort and pain. Usually there's one night in the ICU. Most people don't even remember much of that. 3, 4, or 5 days in the hospital. And then, surprisingly, after open heart surgery, you start getting back to your life within about a week. The pace of medical advances is unbelievably rapid and increasing all the time. I'm here with Dr. Lars Svensson, who leads the Heart and Vascular Institute at the Cleveland Clinic. And Lars, you have seen the advances and innovations over the last few years here in Cleveland. What's been the most impressive advance you've seen?
Well, there have been many, and that's the fun thing of being here at the Cleveland Clinic, is that there are a lot of things we've pioneered and that have come to fruition. I think minimally invasive surgery and remote surgery has become a big thing, like the percutaneous valves that we now put in through the groin, and then also the minimally invasive J incision for doing aortic valves, mitral valves, ascending aortas. That's been very good for patients, and I think they have a lot shorter hospital stay. The results have really been good.
And I know patients love to keep their own valves. They don't need oftentimes cow or pig or metal valves, mechanical valves. I think they love even more the fact that the old-fashioned big incision this long,
Yeah.
we often don't need that anymore. Something like this we can sometimes
That's
slip
right.
in.
That's right. I just did an aorta replacement, ascending aorta. It was probably about, I don't know, just over 2 inches. And we repaired his bicuspid valve, replaced his ascending aorta, and that's what we try and do for most of our patients with that type of problem, and we can usually do that.
What do you think will be our next frontier for innovation? I mean, we're sitting here in a building that's 1 million square feet of cardiovascular care. So I'm thinking whatever is next is going to happen here. What do you think it'll be?
I think there are a lot of opportunities. Certainly, I think we're going to be working in teams much more. The cardiologists are coming more towards doing what we do. We're doing more of what they used to do. And we're combining that with echo. I think probably in the next 10 years, we potentially could do aortic valve replacements with echo in an outpatient situation.
So after your heart surgery, we don't just send you on your way.
See, the top of your target is 114.
There's a 12-week, 3 times per week cardiac rehab program to help patients keep up their good habits and learn new things about diet, nutrition, medication, exercise, and more.
Blood pressure's doing today.
Paul Kalita is a cardiac success story. He has kept up with exercise, walking about 3 miles per day, and his diabetes is now under control. Before your surgery, you had diabetes that was pretty severe. How is it now?
It's much better. The numbers have dropped greatly. I'm on less insulin, less frequently. So everything's going good with the diabetes.
Do you feel better?
Absolutely, 100% better.
Up next on how to avoid a heart attack.
What helps the best is to have somebody to exercise with, a buddy.
So a partner.
Yeah.
A doctor-supervised exercise program that's completely free. Also,
moderating your salt intake is reasonable.
what you need to know about the changes in blood pressure guidelines. And people often don't want to admit they might have a heart issue. We'll share life-saving information, the heart symptoms you simply cannot ignore. "70 million Americans have high blood pressure. That's 1 in every 3 adults. Another 1 in 3 adults have what's called pre-hypertension, blood pressure numbers that are higher than normal, but not yet in the high blood pressure range. Only about half of people with high blood pressure actually have it under control. High blood pressure contributes to 360,000 deaths per year. That's 1,000 deaths per day. The guidelines for when to treat high blood pressure were recently changed. Here's what you need to know. First and most important, you've got to know your blood pressure. You can't follow the guidelines if you don't know your own blood pressure, so you must know your number. Second most important thing is what constitutes high blood pressure or hypertension. That remains the same. If your number is 140/90 or greater, so 140/90 means high blood pressure. Now here comes the change. The change involves who gets medicines for high blood pressure. The new answer is you get medicines if your blood pressure is 150/90. So that's an increase. Barb, we're talking about high blood pressure, hypertension. Tell us your story.
When I first found that I had high blood pressure, it was about 150/90.
And did you have any symptoms, any inkling?
No.
That's one of the most amazing things about high blood pressure. It's among the most common medical problems, and it causes no symptoms whatsoever. But I mean, you're a nurse, so you know what's down the road for people who have long-term high blood pressure and they they don't know it and they don't check it and they don't treat it.
Right, right. But I mean, it hurts all of your organs. It's hard on your heart, your kidneys. You risk a stroke. I mean, it's devastating.
You're on 2 medicines for blood pressure. You're diligently following up. And we just checked. We just checked to see, are the medicines working? Look at the numbers. What are your numbers?
Perfect.
You got 121 over 79. That's a great blood pressure.
Yeah.
The medicines work. And do the medicines cause any side effects whatsoever for you?
No. When I first started on the beta blocker, I was a little bit tired, but that only lasted maybe a week or 2, and that was it.
So I know a lot of people are afraid of taking medicines, but it sounds like your story is just perfect. Your blood pressure is controlled. You take a couple of pills, was it maybe 2 pills a day, and no side effects.
Nope.
Which means you have greatly reduced your risk for heart disease, stroke, damage to the kidneys, all that stuff just with 2 pills.
Yep.
More than half of American adults are going to get high blood pressure. What would you tell them to do?
Absolutely. Make sure you know what your numbers are and get treated.
For those of you who actually have high blood pressure and you're on medicines, the question you're asking is, should I stop my medicine? Do I need to recheck my blood pressure and reconsider? The answer is, keep going with your medicines. We don't want people who are well treated on medicines to change a winning strategy. Dietary guidelines are in flux all the time. They're constantly changing. Dr. Richard Krasuski from the Cleveland Clinic has been a student of salt in the diet. I've got to ask you this. Is salt bad? Because you know those salty pretzels? I love those things. Am I going to give myself high blood pressure or heart disease?
You're probably going to give yourself, worry about that. That's going to cause your heart disease.
I've got that already.
There you go. So I think that actually, moderating your salt intake is reasonable. Becoming obsessively compulsive about it, I think, is probably not. If you look at the guidelines now from the CDC, they really want you to try to go down to 2,300 or below in terms of milligrams of sodium a day. That's, pretty, you have to really kind of push your diet down and do that. And 1,500 if you're 51 or older, if you have a history of high blood pressure, high cholesterol, or if you have kidney disease. So that's a pretty aggressive reduction in the sodium.
So I'm 52 years old. I should only have 1,500 milligrams of sodium a day?
If you follow the guidelines, yeah.
I've heard that some recent data suggests that salt intake does not cause high blood pressure in most people, but if you have high blood pressure, if you already have it, limit the salt. Is that true?
It's very confusing. I think if you open up the literature and you try to find out, the epidemiologic evidence looking at what causes high blood pressure, what should people with high blood pressure do, how much should they consume, you can get almost any message looking at different papers. So what I tell people now is you're probably, it's more important to watch your weight, watch your diet in terms of other things that you're consuming, your caloric intake, and that's probably even more important in terms of getting your blood pressure down than is watching your salt intake.
Coming up on how to avoid a heart attack, free doctor-supervised exercise. We'll tell you where and when, and the heart symptoms that should have you on the phone with your doctor right away. Back in a few minutes. People who are physically active live longer, have lower risks for heart disease, stroke, type 2 diabetes, depression, and even some cancers. Welcome back to How to Avoid a Heart Attack. Lots of good things to say about exercise. And if you're having trouble getting started, the Cleveland Clinic's free Healthy Strides program can help you get going on exercise.
But if you get a cold, it doesn't mean there's anything wrong with your immune system.
So what is Healthy Strides? It's a program sponsored by the Cleveland Clinic where people meet up on Saturday mornings for a little chat with one of our doctors, followed by a 3-mile walk at your own pace.
The purpose is to get people walking and to learn about medicine. So it happens at 8:30 in the morning. He says, how about chicken soup?
We met up with Dr. Tom Abelson, an ear, nose, and throat doctor from the Beechwood Family Medical Center.
And there's usually about 20 or 30 people here, and I answer questions. We talk, and then we walk. It means you got exposed to a virus.
Dr. Abelson talked about cold and flu season the day we joined the group.
So sometimes it's real science, and sometimes it's just fun stuff, and often it's about wellness. Last year, there were 3 admissions to Hillcrest Hospital for the flu. And this year, same month, there were 118. And so it's a nasty one. He's asking if local honey helps because of the pollen and so on in the area, help with allergies.
After the talk, it's time to get moving.
walk in the mall here, if you walk around the periphery of the mall on either the first or second floor, it's a half mile. The goal is to walk 6 times around, to walk 3 miles. We walk each person at their own pace. I'll walk with new people or whoever feels like walking with me during the talk. So it's not a group walk, but it's a group talk. I think what helps the best is to have somebody to exercise with, a buddy.
So a partner.
Yeah.
You've taken it to the next level. Do it with a partner, do it with 20, 25, 30 partners. Healthy Strides groups meet on Saturdays at 8:30 a.m. at Beechwood Place Mall, Strongsville Recreation Center, and Dodge Intermediate School in Twinsburg. In Medina, Healthy Strides meets on the second and fourth Saturdays at Buckeye Woods Park. Other locations will be added as the weather improves. Call 216-312-5640 for more information on Healthy Strides. Yesterday, a patient asked me, what's the single most important thing that I can do to keep my heart healthy? Should I take an aspirin? Should I take a statin? And I forgot I was coming here this morning, but I answered, no, walk. You don't need to buy anything. You've got the equipment. Feet with shoes. Why is heart disease so deadly? Well, part of the problem is delay. People wait too long before calling for help. Everyone knows to call 911 if you have sudden chest pain, but what about the less intense symptoms that can also signal a heart attack? Heart symptoms that you should never ignore include any sort of chest pain. In addition, shortness of breath, wheezing, nausea, and pain that starts in the chest and spreads to the shoulders, arms, back, neck, jaw, or abdomen can all mean a heart attack. The pain can come and go. A rapid or irregular pulse can be another symptom of a heart attack or a serious heart condition. The bottom line is this: don't hesitate to call 911 if you're having heart symptoms. It could save your life. Oh, and one last thing. A glass of wine per day is actually good for your heart. So here's to staying out of my operating room.